Hi, welcome, Maggie, Eden, Fred, Katerina, Zonke. Oh, yeah, the heat wave in Europe.
Oh,
Um, all right, should I go ahead and get started, Elaine, do you think? Or
I think so. Yeah.
yeah. All right. Well, welcome everyone. I'm Nellie Mecklenburg. I am part of the Movement for Community-Led Development, but I'm also a part of the Anchor Group, which is a small group of folks who are just helping to coordinate and organize this community of practice. So today is the third call in our community of practice for advancing more community-led approaches to monitoring, evaluation, and learning. Uh, we're going to begin today diving into the MEL cycle and looking at how assessment and design can be a more community-led process. But for anyone who is new to this group today, and just as a sort of reminder to all of us, I wanted to just orient us in what this community of practice is about and how we work. So, this is a new space. It's a space for practitioners of all kinds who are actively learning with communities, whether that's as MEL officers, as staff of NGOs or civil society, as community mobilizers and organizers, activists, researchers, anyone who is doing this work. And some of us may use the language of MEL, and some of us won't. We see this as a learning space, but also a space of connection. We aren't trying to have a really specific outcome, at least not yet. We don't want to be too technical. We don't want to be too formal. These aren't training sessions. So if you're, looking for an introductory guide to monitoring, evaluation, learning, or a very specific set of learning outcomes, this might not be the space for you right now. Um, because, while we recognize and we appreciate that we don't all use the same terminology, we also don't want to spend too long on, definitions. Instead, we really just want to be learning from each other's stories, which we're going to start doing today, and to have dynamic discussions around ideas. So we are, really just hoping for everybody to be engaged, participate, share, and be an active member of this group. We used the first two calls to establish a charter, which is really just a common framework for how we want to work together, as well as some foundational language to anchor us as we're moving forward. We have those documents, they're living documents, and you should feel free to continue to provide feedback and, you know, edits, suggestions to them. We want them to continue to evolve as we move forward. And also, if you want, at the end of this call, we're going to have an additional 30 minutes where we can talk more about the charter itself and sort of who we are and some of that language. But as I said, in today's call, we're going to really dive into what this work looks like in practice. And we hope that that's where we spend the majority of our time as a group. We're going to look specifically at, we're going to be looking at the different phases and approaches of evaluation and methodologies that can have more community ownership over the course of our conversations. Today's call, we are going to be starting by looking at assessment and design. You will have seen from the email that for us, this means we're looking at the beginning of the MEL cycle at how do communities gather information to plan their projects and to create and communicate their ideas and their theories for how change will happen. You can go to the next slide. Um, as our calls continue, we're going to loosely follow a MEL cycle. We started by looking at what is community-led MEL, or community-owned MEL. We discussed, as I said, through the principles and values of CoMEL and how those apply to us. Now we're looking at community-led assessment and design. And then moving forward, we'll be looking at, indicators, community-led analysis, synthesis, sense making, and so forth. Next slide. And that structure broadly aligns with this overall look at what the community MEL cycle is. And this was developed by MCLD members over a period of time. So with that, I'm going to hand us over to Elaine to ground us more in today's topic. Although before I do that, I just want to say that we're going to possibly have breakout rooms. We will be having discussion in today's call. That might be in breakout rooms. It might be in the main room. If we have breakout rooms, we are fortunate that we're going to have one room that can be held in French. We don't have the resources right now to have the call translated between multiple languages, but as a starting point, we're at least hoping to have small group discussions that can happen in other languages just for easier, dialogue. So if you would prefer to have a conversation with other folks in French, please, you can either change your name in the Zoom to have FR at the beginning of your name, or if you can't change your name for any reason, you can just put it in the chat and we will keep an eye out there. With that, Elaine, over to you.
Great. Thanks so much, Nellie. And yes, so we're starting to get into the meat now of our work. And again, just looking at this roadmap that we have, as Nellie said, we're following loosely a project management cycle. So those of you who have done a project management course, you might see some of these terms. So this next 5 minutes will be focused on breaking down what does assessment and design mean. And within each of these steps in a project cycle, so assessment and design, monitoring and evaluation, and anything following. Oops, I'm going the wrong way. There are these steps. So if you're doing at the beginning, you'll see in the presentation today, how are they talking about who decides the purpose of the data collection, who's framing those learning questions, who's creating the theory of change, and then there's a period of collection and who is doing that work and then analyzing reporting. So this cycle just repeats itself at assessment and design and again during monitoring, and then evaluation, whether you're doing it at the beginning, which we often call a baseline, meaning we're trying to do a starting point in time, or midline, which is kind of in the middle of a project, or end line. And so those are some of those terms. In the document that we sent out on principles and terms, these are the plain language definitions for the terms that we're focusing on today. So what do we mean by assessment? Very simply put, this is just the data collected to inform the design of a project or intervention. So it's what comes before when you want to know, okay, what is the best way to approach this, or what are the gaps in what we want to do. And so this is, again, it's systematic, it's a structured process. You're working with the community to say, what is it that we don't know yet? And so you may have heard of other terms like a needs analysis. What's needed in this situation? Risk analysis, where are the risks for the intervention that you're moving into? We strongly recommend a power analysis. Where is power sitting currently right now? What capacities and resources are in the community already? What is the gender dynamic in the community? And what would the potential impacts on the environment be? And what are those pieces? So again, we said these are living documents and living definitions. If you feel there's a key concept that's missing from that term assessment, please feel free to add it in the chat. We'll note it. Or if you want to just focus on what I'm saying right now, you have the link to the Google document. You can go back and add in some thoughts and comments, adjustments. In terms of design, then, after you've collected this initial information, or rather, I should say the community has collected this initial information, then they start to make a plan. And so this is basically identifying what are we going to do? How does that connect to higher levels of change? in terms of best practice, it's really about going beyond, we're going to do these specific activities and really making those cause and effect linkages to identify what do we really want to see changed, right? And so you'll see these great examples in the presentation from Walter later today. He has an example of a community-led theory of change, but basically that's the concept of design. And so theory of change is a term that has come up, I want to say, what, in the past 15, 20 years. And as I said, it's just a cause and effect diagram. If we do these activities, then this is the short, medium term or short term, medium term changes that we'll see so that we achieve these longer term results. And so we really want to map that out because we all have theories of how change happens. And we really want to test those by using evidence. And so this is why we feel the theory of change is an important tool. Of course, many of you will be familiar with something called a logic model or a logic framework, which a lot of donors use. And the way I would differentiate a logic model from a theory of change, and again, many people use it differently. And I would say a theory of change for a project is that it takes part of a theory of change, which can capture a lot of complexity and puts it into a kind of neat boxes that fit into a logic model. And so, and what's within the control of a project. So, any quick questions or comments that need to be highlighted at this time? We didn't want to spend a lot of time here. We just wanted to make sure we had some common understanding as we move forward.
And I would just add that I put this in the chat. The chat is a great space to add thoughts as they come to you throughout the call before we have that discussion time.
Yeah. Did we put the link in the chat? Okay. There's I had it ready. So that's the Google Doc with all the definitions. So, and this is not about getting like a perfect definition here. Again, this is just about making sure that when we talk about assessment or design or theory of change, we have a common understanding. Great. And if you do really want to delve into these questions, please stay for the extra 30 minutes if you can, and that's the time. All right. So I didn't see anything too much in the chat. No one flagged it. It's hard to keep track of all these multiple screens. So now that we kind of talked about the meal terms that will relate to today's presentation, I really like this framework that comes from a while back, 2013, and it's from an Indigenous evaluator in the Pacific Islands. And I love her name's Nan, and she's very lovely. And so she put together this framework, which I have used as a base kind of reflection tool to say, are we, on the left-hand side is where it's more Western imposed or donor imposed or organization imposed. And then to the right is where it's more community owned, or in the language that she uses, where Indigenous communities are able to make their own choices and have self-determination. And so they have that agency, they have that power to make decisions. And so for a long time, we were doing meal to communities. We go in and have external organizations or external people to communities asking questions. They don't even know why, really. And then we started moving to for communities, where at least we were starting to circle back the information back to communities. And we then in the 70s started seeing a lot of participatory methodologies where we were starting to do some of the data collection, at least with communities. And where we want to get to through this community practices, how can we shift it to that upper right-hand corner, top right-hand corner, to having these meal processes being done by the community, or the community as evaluators, the community as the ones who are gathering the information and making sense of that to inform the work that they're doing. So that's a nice little resource. I can add the link to that if you want to read the full document. Okay. Oh, sorry, let me go back. I think we have a quick poll. So I know we just introduced this kind of framework, but we've been talking about this throughout our past two uh, sessions. How can we really put the power in the hands of the community when it comes to monitoring, evaluation, accountability, and learning? And so I'm going to ask Sarah to start the poll. Um, and we're just asking the question, where do you feel your work sits on the community-led continuum right now? And if you have done an assessment in design, think about it from that perspective. If you haven't, just where's your work right now? We again are just doing a starting point poll for this. So we'll let that go for a minute and see where we're at.
And I'll add, as people are doing this, that one, it's anonymous, but also this is really a self-reflection activity. And it's just to be thinking, we're all here because we want to be strengthening this practice and to be thinking about where, when we think honestly about the practices, which aren't all in our control, like there's a lot of other factors that influence that. Um, where do we think we are in this scale in order to think about where we want to be moving to? Um,
Last 10 seconds for people to vote. I think we're kind of seeing it coalesce there. Great. Sarah, do you want to close the poll and let everyone see? So hopefully you can see the results here, where we have the biggest cohort. A little over half of us here in the call are doing meal with the communities, which is great. It's about where we are in the industry. We still have some who are doing it for communities, which is fair. It's taken us a long time to just learn how to do good meal, and then so exciting to see that we have close to 30% who are doing by or having the communities as the evaluators and monitoring folks. So that's a great result to start from. Without much further ado, I'm going to hand over to Molly and switch the slides so she can introduce, our speaker.
Thanks so much. That was a really great introduction to this, Elaine, and I always like to show that kind of continuum of to explain community-led development to folks and that shifting of power. So my name is Molly. I'm part of the anchor group for this community of practice, and I work with Salanga. Salanga is the co-creators and stewards of the CoMEL approach. Its name sounds very similar to this community of practice. A principles-driven approach that systematically positions communities to define, measure, and lead their own development journey. And Walter, who's going to speak, works with ADRA Uganda, implementing the CoMEL approach through the Together project, which is funded by Global Affairs Canada. I'm really excited to hear from Walter. He's a champion and truly embodies the principles of community-led development. So I know we're all going to learn something from him. He's going to speak about how communities have been able to lead their own assessment and design within but separate from the overall donor project logic model and really lead their own assessment and design. So passing it over to Walter.
Thank you so much, Molly. Good morning, good evening, good afternoon for everyone online. My name is Walter Kibwota, CoMEL officer from Together Project, ADRA Uganda. Being actually ADRA Uganda is implementing partners, which is working in conjunction together with ADRA Canada through the funding from the Global Affairs Canada. And we are working in partnership with Salanga that had been able to give us the capacity building. Uganda, maybe someone might have heard Uganda and so on, but Uganda is one of the countries in Africa, and it is found in East Africa mainly. And in East Africa, where Together Project particularly, it is mainly northern part of Uganda. Uganda is a very interesting country, which lies along the equator line. We have the longest rivers, that is River Nile, starts from Uganda. Even our president, the current president, had been in power for 40 years. So those are some key highlights, very interesting about Uganda. Uganda, at the moment, have a population around 42, actually 52, around 52 million people. But mainly Together Project, we are in northern part of Uganda. As you can see, Lamu, Kitgum, Pade, and Agago, the district which are highlighted. Those districts, we call it Achole, that is East Achole. Most people in the northern part of Uganda are mainly actually the Luo, let me say like this, it is Luo, but the entire northern part of Uganda is covered by about 5 different tribes. We have Luo, we have Lango, we have Lugwara, we have the Karamojong. So basically, when I talk to in relation to this project, as you can see, like our area of operations, we are mainly dealing with the communities, so we are working with the communities that are in rural areas. These communities, especially the Acholi or the Luo land, some years back, actually in 1986 up to around 2006, we had been under a serious civil war under Joseph Kony, for those who might have heard about him. And within that period of time, we had been in the internally displaced camps or settlement for about 12 years. And actually, that lasted almost up to 2006. So it is around 20 years, and we are now back into our respective locations. So at the moment, we are operating in Kitgum, Pade, Agago, and then we are operating with 21 CoMEL groups. When we talk of 21 CoMEL groups, in Uganda, we have a setting. There is Uganda as a country on its own. Then we have districts. There are different districts which are coming from the different regions, like there are a number of districts in northern Uganda. But within the district, we have the leadership that are broken down into sub-counties, and sub-counties form what we call, actually sub-counties are broken down into parishes, and then parishes are broken down into villages. Villages are being actually managed by a local council, one that is a committee, that's a local government setup, which is at the lowest level, that manage the villages. When we are talking of 21 local settings, that villages, that is what we are trying to mean, that we are working with 21 units of government at the lowest level. And we do actually community-driven accountability approach. It is why we talked about that, because they are doing by themselves. We only put some small addition. So CoMEL actually promotes inclusive participation, both females and male, and we are doing that one equitably, and participation, shared decision making. This inclusive accountability had made it very interesting in northern Uganda. CoMEL approach, we really enjoyed it. Can move to the next step. We have our areas of focus in Together Project. Together Project, actually, we are handling sexual, gender-based violence, and then sexual reproductive health rights. We are also looking at water, hygiene, and sanitation as a component. We also looked at nutrition and kitchen gardening. Nutrition, why? As I was saying, this community had been in the settlement for a kind of a period of time. So there is that reluctancy that they still have at the back of their mind, that things were, those days, things, they would give them things. So people have not yet engaged a lot in their actually major activities. That's why nutrition is a little bit key. We're also giving life skills and parenting. Sometimes you realize that in Uganda, most of the parents are complaining that they are no longer able to handle their children. So we are trying to put a lot of effort on parenting, such that children are really being put upright, such that they are the future and they become the role models, people who are responsible for the nearby future. We are also handling the VSLA, that is the Village Saving and Loan Associations. This is an approach which is helping people to save some little money that would help them in various areas. One, they can save the money such that they can have a family goal. so that at the end of the cycle, that they normally do it like for 12 months. They're able to have that money, buy for some few items that they feel is necessary for the family, or even they will use that money to pay school fees, or even they use that very money to buy other things which are nutritious that can support the growth of the family. Then the last part of it is a CoMEL approach, which is still a new approach. The rest which are up above, the other area of focus above there, were not all that something new to ADRA Uganda, but the new approach was CoMEL approach, of which Walter is the one directly implementing, and we are talking about it basically. In our CoMEL approach, when we looked at the community representations, we highly considered adolescents because in a community setup, there are all these kind of people in the setup. So we consider adolescents to be part of the team. We looked at people with disabilities to be included. We consider cultural leaders because here every society are being led culturally. There are also religious affiliations. We also looked into that one. There is also political leaders that we also have to ensure that they're also part of it because in that society, there is a coexistence between those cultural, religious, political leaders. So we make sure that they are part of the CoMEL. We consider youth leaders. We looked at the health workers at the village level. Those are community health workers or health workers and elders, because in every society, elders always give their voice are always the strongest. When they tell the young one that those days things were like this, they will always obey. And then we consider like 50-50 of the females and male. However, those days, most of the leaders, you find that females were very few and males always dominate, even in public speaking. But with CoMEL approach, we have reached this level. When I looked at the steps that had been shown at the beginning, I was very impressed. I realized that today we are in the third steps. But however, the way we have been doing in Uganda, the CoMEL approach that I've been doing, I had 7 steps at the back of my mind. The first step that I normally consider was the formation of committee. The committee has to be formed. That is why you looked at the different community, how communities are made up. They're made up of elders. And that's why the first thing we looked at committee formation. The second step we looked at assessment and design and integrated development, monitoring plan, tools and data collection, analysis and interpretation. Then lastly, they disseminate the finding back to the community. That is the steps, but we can go down now and then we handle assessment mainly. Unfortunately, the products look a little bit smaller in size. I really apologize for that. But then when you looked at the first step, that is committee formation, we're looking at assessment and design. So the first part of it, we consider committee formation. That is when you looked at the way people sat there, that is the picture taken during the formation of the committee that ADRA went on ground. That was the village we have selected. The village is called Labongoro, very popular. Actually, they are the role model village in Uganda. What they are doing at the moment, if I'm to be given an opportunity to narrate more about them, it is extremely believable. So that is the formation where they select by themselves. They always put like the male champions, a man who is a role model man in the village. They put female champion, someone who is a role model lady, such that they become part of it. They look for elders. They look for the youths, 2 youths, like a boy and a girl. They always look for the VHT, like the village health team, part of the local government. So in these formations, they make sure that all those, and in this formation, for Uganda, the way we were doing it, there were 2 different committees. We were looking at the structure of the LC1, the local council 1, in this formation. They already have the 11 in number, 9 to 11 in number. That one, we already adopted that structure. And then we have formed a parallel structure which work together. For them, they only do monitoring and evaluations. We call them CMLCs. And that is where we were able to bring in the gender composition of 50-50, so that when they were doing the selection of the VHT can be a female, and the elders can be like male. They have to make sure that in that composition, when we give them those kind of the structures, they are able to ensure that female at least 50, or maybe like even more, 60-40. That was our target. And it helped us a lot to work. So that was how we were doing the formation of CoMEL structures in Uganda. When we go to the next step, that is problem identification. Problem identification, if you can see, this is the template that we developed. Actually, it evolved when we started CoMEL at the beginning. It was not reaching this part. People were just almost raising down. But finally, we realized that after coming up with the problems, the community will identify as many problems as possible, and they will debate about it. And then they will rewrite, just like the way you're saying, the way you're saying there is a poverty, there is a tribalism, there is alcoholism, there is early marriage, there is stealing, land problem, GBV. They will list all of them according to this number. They put it like that. And then they make sure that they display the table on the wall or on the board like this. Then when you are seeing the pink, those pink things which are put like female and male, we give them a number, we give them papers in their hands. Then after debating all this, because if we are to say by show of hands, people will feel a little bit intimidated or feel like I am young to raise my hand for this. Then we give them out of this number from 1 up to 10, all these are problems. According to you as a community leader, which one do you think it is the most pressing problem that you feel like it should be solved fast? And then they write the secret number. They write only the number in that paper, and then they follow it very well. We collect all the papers because those are their views. We don't want people to sit on their views. That's why you write secretly in your paper. And we collect all the papers. Then we begin opening. We make sure that if you're a female, you put F, and then you write the number you want. If you're a male, you put M, then you write the number you want. After writing these numbers, we collect all. We pick a participant among themselves to collect all. And then they'll open paper one by one when everyone is seeing. They open, and this is male, written number 1. Number 1 is what? Poverty. Then we pin the pink color for that person. Then that number is put with what that one is put aside. They continue open. This is female, number 1. Number 1 is what? Poverty. This is a male, number 3. Number 3 was stealing. So at the end of the day, they pin all their views, and they would become very excited that, wow, Kumbe Mia was thinking that early marriage was a problem, but the majority is looking at poverty as being the major problem. So at the end of it all, they do the total, and which one has scored the highest become the community problems. And that would be the community major issue that they need to address. That is when we'll put the community ahead of it. So that is how they do the problem identification. After the problem identification, they move to the root cause. As you can see, these products are not from the same community. The other community, their problem was like poverty. But now, their problem was poverty. But now here, they look at the root causes. Yes, root cause of poverty, correct. The same root cause of poverty. Now, when we divided them into groups, I forgot one thing. When they were doing problem identification, we make sure that we divide them into groups. The more groups you divide, the more ideas come. And the more active all of them would participate. And when we are dividing the group, we make sure that there is a elderly person, there is a youth, there is this. We don't combine all of them. We make sure that they are distributed equal, and we encourage them to see which group is going to come up with real issues addressing the community, such that when they are presenting their finding, they would feel so happy. And during the presentation, we encourage that if you presented for this time, the next presentation, someone will do the presentation. Says that was another way of empowering women and the young ones to ensure that they can speak in the public. Now look at the root causes. When they were identifying the root causes for poverty, they were in groups. So they brought all their ideas, and then they rearranged land, laziness, jobless, alcoholism, misunderstanding, early marriage, and so on. Now, this is the same story as like, get a piece of paper, write for us a secret number of yours, that you feel like it is the major problem of poverty. Another interesting point about these products, we got it from the settlement. In Uganda, we have refugees from Southern Sudan that came into Uganda. So right now they're in the settlement, but we are also implementing CoMEL approach in the settlement. And these products are from our brothers and sisters who are in the settlement in Uganda. So after identifying the root causes, when you looked at how they paint their things, female, two females said it is land. Four males said it is land. One female said laziness. That's why there is poverty. About one female said it is alcoholism. And then two male were saying alcoholism, misunderstanding. But after ranking, after adding all this total, land became number one as the root cause of poverty in the settlement. And indeed, in the settlement, they are always given a small piece of land. They don't have vast lands. Therefore, this had given me a very clear clue that community are able to identify their own issues and what would be the root causes exactly. They are poor because they have a small piece of land. After identifying the problems, after identifying the root causes, the problems and the root causes, community will now find a way of making the statement. This is from a different community. That's why I'm saying theory of change from the Charlie. This is from the host community, not from the settlement. And this host community, their major problem was alcoholism. That the entire village were really feeling like alcoholism had destroyed everyone. And I remember in this village when they were voting, women and men, all the same, voted for this. However, most of the men were going for GBV. The community problems would define community goal. If it is alcoholism, they will now define it like they would like to reduce the level of alcoholism. And what are the root causes of alcoholism? For this community, they're saying it was gender-based violence causing alcoholism because men and women. The more, when a woman advises a man that, Walter, the rate at which you are taking alcohol is not good, can you reduce? For me, I'll consider as the GBV. I may think it is a woman which is now quarreling against me. And that's why here you find GBV because most of men were saying GBV. So GBV became like number one of the outcome or number one of the root causes. Then another root causes that they found was also causing alcoholism. It was a very unique, again, they were saying level of poverty, they are very poor. That's why sometimes they end up drinking alcohol because so that when you drink alcohol, you forget about your problem. So that is how they designed their theory of change. We can move to the next one. After designing the theory of change, community would sit down and say, if we want to reduce alcoholism, and we have realized that the root causes of alcoholism are GBV and then poverty, they have to go and identify the activities which should be done to reduce alcoholism and activities which should be done to reduce gender-based violence. So this is the template that we are using with them. We feel like it is a little bit simplified based according to the level of our community in terms of understanding. So we looked at the activities. They need to put their activities. They need to put the activities. They need to identify who do they want in that activity. The target groups that they want to involve. If they want to do sensitization to who? And then when are they going to do that one? And then where exactly? And then what are the village resources that they need, which they feel like they have? And then is there any resources that which is required for a particular function, but because they don't have it, they would wish to collaborate or coordinate with external people such that that resources is provided. So that is a simple template that we are using, and it is a little bit easier for our community at the grassroots level to fill it. Thank you.
Great, and thanks so much, Walter. We have a few more slides that you're going to present. We'll just do that a little bit faster so we can allow you to answer the questions.
All right. We were trying to look at how data can be used, the importance of data. When you see people down here, this is during community problem identifications. They did the ranking, they were surprised, they were amazed that through the ranking, they generated the data, and that data helped them in collective decision making. That has helped them in community action planning. That has helped them to have like evidence-based adaptation and accountability, because it will remain like it is community that already agreed that this is the major problem and this is what we have to work on it. So it will remain like a kind of a base. They have it in their files. Yeah, there are a number of positive changes that we have seen during this CoMEL intervention in Uganda. We have realized a very good reduction in sexual gender-based violence. When you looked at this man in the garden, um, actually he was the best alcoholic man in the entire clan. But when the CoMEL arrived, he changed totally, and he's now in the family of this garden. Actually, his wife told us the other time when we were doing that training, the wife told him she was almost about breaking up with him, because I said for 6 years, it was almost, but CoMEL supported her, and now they are back. Reduce alcoholism, the same to him. There is a good reduction in teenage pregnancies. We have improved school enrollment, as you can see from this, the temporary bridge constructed by one of the groups. There is improved agricultural interventions, as you see the other gentleman and his family. We have improved access to social services. We have should have been some photos there. Women and youths are empowered. There was a chairperson who said, "ADRA, this CoMEL process helped me. I used not to stand and speak before people like this. I am proud of you." That was he was telling us during a Village Action Day. There is improvement in environmental conservations. Most of these CoMEL villages nowadays, they're planting the fruit trees. The fruit trees are helping them. One, it helps in environmental conservation. Two, they sell the fruits such that it helps in reduction of poverty. When there's a reduction in poverty, it leads to reduction in gender-based violence. So that same trees that they're planting, it is a number of things because it helps in the school fees. Thank you so much. Next. What work well? To my perspective, positive community attitudes. When community have positive attitude toward the approach, and also the facilitator, like Walter, who has positive attitude towards my community, would make me really implement very well. We use the existing LC1 structures, which was already there. That was not our new structures, which means it will not collapse because ADRA is no longer there. Inclusive committee compositions that we ensure that all the categories of people are included. We also embedded the child care support during participation, such that when a mother who is breastfeeding, she's one of the participants, we make sure that we have a child care person who will be available in the venue, and that would be her role. They were trained by ADRA to make sure that they keep taking care of children, such that the mothers of the children would participate very well. There were some few challenges and then adaptations. This one actually had gone beyond even data collection timing. Sometimes we used to relax a bit, and then after the community had already done their assessment and design and what and so on, so they delayed to pick the data when they've already seen the change, and that had been a kind of a challenge, which means, but adaptations like immediately after the training, let community collect the data as raw as possible so that they are able to see. Training schedule, sometimes the project push us to put our training schedules, like in July, like in June and what, but then sometimes find that it interfered with the community activities, such that, but what we have done here is like consultations to ensure that we possible consult community, not to interfere with the training schedule. Mentorship and follow-up. Yet looking at the number of the CoMEL groups, they are up to 21 with one CoMEL officer. At some point, it was actually overpowering me, so I take long to reach the community with my mentorship. But it may be like a little bit that we are like one or two, actually 2 or 3 would be in position to manage, which means for the next CoMEL interventions, they need to consider, or the project need to consider the number of the staff vis-a-vis the number of CoMEL groups that they want to. Alignment with the community calendars. This should be the answer for the training of the schedule. It is very important. We were not aligning our activities with the community calendar, so we've been clashing We want it to be done, but at the end of the day, you'll find community are very busy on this. At the end of the day, you will not succeed what you want. But actually, consultation work there. Thank you. We move to lesson learned and success factors. We actually, when you looked at this beautiful picture, this is in a Lenyo community. This is the community that came on their own and they facilitated their CoMEL training on their own. Meals, transport, and everything was on them. We only supported them. That is another amazing story. And a number of clan leaders nowadays, they want. We have received a lot of letters, requests for ADRA to support. So strong knowledge of CoMEL, like the way Zalanga gave me a very good capacity building, and I have a very strong knowledge of CoMEL. That is something that you must have at the back of your mind. Community entry and stakeholder engagement is very, very key. As you looked at this, the way one of our staff was speaking here. So everyone was attentive and we know who should not be left. And then well-structured committees. I really feel like women are more powerful in this committee. The best CoMEL village in Uganda is being led by a female, and they're the one doing actually the best. And then local ownership of the outcomes. At the end of the day, whatever you're doing, your facilitation, make sure that it is tending towards local ownership, so that at the end of the day, whether you are out, the community will continue moving on their own. I think this is almost coming to the last slide. When you looked at this picture was taken from the settlement when they were doing their assessment and design. This lady was saying, we are the one not using our mind correctly. If we really sit down and put our brain at work, there is no way we would be poor. That was our remark. That's when we took our photo. I would say thank you so much for listening. I am very impressed for the opportunity that you have given me to share whatever Uganda is actually experiencing as far as assessment and design is concerned. Thank you so much.
Thank you, Walter, so much. This was, I mean, it's an amazing example of applying all of these, different ways of thinking about this and different tools and as we'll see, the principles of community-led development and of CoMEL. And also you really walked us through your process, and we really appreciate that. There's been a lot of comments in the chat. There's been questions. I can flag some of them. I also we're going to open up to discussion. So officially the call is an hour, but we also have 30 minutes afterwards where we can keep going with this conversation for anybody who's able to stay on the call. And we can also possibly use our next call to continue to dig into some of these questions that people have raised and to, look at more examples and things. We'll check in on that before people hop off. But as we open up discussion, Elaine, do you mind just putting the slide up with the CoMEL principles? One of the things that we'd love, Walter, from your perspective to think about, but also anyone in this group, especially, to be looking at these principles that we all reviewed and sort of agreed on broadly of, what it means to be doing CoMEL. And we're curious, just to be thinking about like which ones of these, many of them, were present in Walter's example and the work that they're doing. And are there places where, more of this could be integrated? So I'd love to hear your thoughts on that, as well as just questions people have generally for Walter and for this example. I will pause, and otherwise I will raise some of the questions that came up in the chat, but I'm just gonna give a moment. If you want to raise your hand and come on, or yeah. For example, Gail, you had a couple of questions, including around how tools were adapted for folks that are less literate, and about using existing groups rather than bringing new configurations together. Do you want to raise any of those questions, and then we can go to Arifa after?
I mean, yeah, thanks. Thanks, Nelly. I mean, to answer the first question, I saw a lot of these principles in Walter's presentation. Thank you, Walter. It's really great to see what's
Welcome.
happening in Uganda. And yeah, I mean, I think we all struggle, and I would love to hear more about how the local council, the LLC ones are relating to these committees that were formed and those roles and responsibilities. And one of the questions, and I'm really excited to see that in that project phase, you added, the organizing phase, and wondering also if you've ever worked with through existing groups. I know that brings its own challenges for inclusion and who participates and whose voices are heard in existing groups. So I guess that's a two-part question, Walter. How is the LLC relating to these new groups, and have you had experience working through new ones? Those are just a couple of questions. Thanks.
Walter, do you want to reply to any of those now, or we can just keep going and you can respond a little later?
It is well. It would be very good if I can respond quickly.
Go for it.
Our question was like, how does the LC want, the local council one related to the call to the communities? The local council ones are the government structures, which comprises of about 9 to 11 community members. Therefore, in the government system, they are the one responsible for the community management of the entire people in that very village. And since we already adopted that very structure with all the community members in their leadership, therefore, the community members are the very people that are leading. And we made them to be, we call them the CMC, Community Management Committee, and it's their role to identify the issues affecting the community. And good enough, among them also, they also considered like women, people with disability, elders, and there is a good composition also there. But then alongside, we selected the different people to form to do the monitoring of their activities. So mainly, it is the local council one committees are the one who are responsible for the assessment and design because they are the leaders of government, and it is their role to identify the key issues affecting community, and they can now do advocacy, pushing it up. Thank you.
Thanks, Walter. Let's
Thank
go
you.
to Arifa and then Fred, and then maybe Sarah Johnson and Clara after. Arifa, go ahead.
So good afternoon, everyone. Thank you very much, Mr. Walter. I think this is the second time I'm coming across somebody called this name, but the other person is a Kenyan person. So thank you very much for the presentation. It's kind of, like when you speak, it's like one of my staff talking about, localization and, locally led community approach. However, we are also doing the same, but ours was based on the project that was funded by Engineers Without Borders to construct a school in a particular community. But in this approach, I don't know if this was the same with you. That is why I want us to clarify it. Probably I made some mistake or there was something I needed to learn. In this of our own approach, the community itself had to put some resources for themselves to say this is what we can contribute to the project. It was not solely money from Engineers Without Borders who are the donors. But again, the community was like, okay, if we are coming with money, get us things that cannot be bought in our community. We will appreciate that. Like you think of shovel, you think of a pan, you think of, knife, you think about, building material. But what we can offer is if there is any money for sand, don't give us that money. If there's any money for granite, don't give us that money. If there's any money for labor, don't give us that money. If there's any money for wood, local wood that will be used in the construction, don't give us that money. We can provide sand, we can provide granite, we can provide local labor, we can provide bricks, we can provide anything that is local to make sure that this project works. But then my question is, in all of what you do in the CoMEL approach, how do you manage the expectation of people, especially the local community people? Because even when they design project for themselves, at times the expectation of community people is very, 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 very key. For me, I might have, another approach on how I manage their expectation. Just like I told you, that these people are coming, they don't have money, they want to help the community. So it's the responsibility of the community to do most of the things. And the money from the donors can just be used to do what we cannot find in the community. But how are you able to manage community expectation? Because community expectation in project planning, implementation, and evaluation is very, very much important. Thank you.
Thank you so much. As I said, it will be very good if I'm to respond very fast. Community have a lot of expectations, but at the beginning, I normally tell them this community-led, just from the definition of community-led, which means ADRA is only behind to support one way or the other. However, at some point, we had been supporting them through community action grants that out of whatever they have identified, like one of the outcomes, they pick one of the outcomes. Maybe it is poverty, but under poverty, they may say they want to do kind of farming. And that farming, they want to put like sunflowers. Therefore, ADRA supported them with that. However, there is another community that surprised me a lot, that in them, they identified low level education as their major problems. And as a result of that one, they started implementing all what they want. But at the end of the day, they collaborated with private partners. And there were two people that came into that very community and opened up two nursery and primary schools. And that school has a school feeding program in it. And is a community actually supporting everything. ADRA had never put any single money in it, but the school is doing well because they realize their problem, low level educations. So they are the one supporting, and things are moving on down because they have known their mistake or they know what they want to do. But however, in other part of it, we are supporting them through community action grant. But we were able to clarify at the beginning that this is community led. Thank you.
Thanks, Walter. And I'm going to come, Fred, to you and to Clara, and we're going to keep the conversation going for those that can stay on. But I know some people are going to have to leave because we're at the hour. So one of the things that we wanted to, I'm just going to kind of jump in, Elaine. I hope that's okay. One of the things we wanted to check before we closed the call was, in that cycle that we looked at, the next topic is on community-led indicators. But do we actually want to spend the next call continuing to dig into this topic? And some of the more get into the questions that have been in the chat box that have been coming up and see, hear from more people about their own examples and their own work in this. So we're going to just do a quick poll. Sarah, if you don't mind throwing that up, just to hear from folks before they have to before some people have to hop off and hopefully others can stay on.
Well,
And then Fred will come to you just after. Okay, we've got some people responding. We'll give it another 10 seconds. Okay, it's hit kind of a stasis. So we can end the poll and share it. About 2/3 of the group have asked for another session on assessment and design, and 1/3 for moving on to the next topic. So we will confirm by email, but I'm pretty sure we'll have another call on this to again just follow up on.
Yeah. Nellie, there was also a great suggestion in the chat where if the next topic is on community-led indicators, that we could kind of have a bridging
Cool.
of the two. So we will collaborate and get back to people.
Awesome. If you have to leave, thank you so much for being here. We'll share the slides and the recording, and probably the questions and things from the chat also. And we'll also share the date for the next call. But yeah, and keep, either by email or in the registration chat. Let us know when you have stories and you have examples that you'd like to feature, either the way that Walter did today or in breakout rooms, or just with sort of smaller presentations. So let us know. Let us know about that. All right, we're just going to keep going. So Fred, over to you. I think Walter can stay with us. Oh, you're muted, Fred.
Oh, okay, sorry. Thank you, Walter. Very appreciating the presentation you've given. It's really a very good example that CoMEL is really making a big impact in Uganda, especially in northern part, as you said. We understand our communities African communities, have almost similar challenges with regard to the culture related, especially on the issue of gender. And you as you've shown, when you are collecting data or information, you found out that some of the issues that came at the top were like alcoholism, that led to poverty, led to TBV and all those things. I wanted to know, how do you create relationship to a point of being trusted? Here, I'm talking about the issue of relationship. How do you come to a point of proving the security or the flexibility of the male members of the community, the men, to be free to engage their female counterparts? I think maybe they're going to come on the same page, because sometimes some of the communities would be hesitant and so much adamant to engage on this kind of issues, because they would really think you're going to remove them authority. You remember, we live in a patronymal communities where men feel they're the leaders of and decision makers of the families. So how do you create that kind of environment? That's the first question. The second question that I wanted to ask quickly, Walter, you really said that with the principles of CoMEL, community members are the owners of the data that are collected. Now, how do you ensure that data is kept, for the future process? Because when data is collected, it has to be processed for the future. Because the communities today, there are these members of the community, and tomorrow there are these other young members of the community. Sometimes even similar problems could recur, could come again and happen. So how do you ensure this data is kept for the future use? Because communities sometimes may necessarily not really know the importance, how important data is to refer for the difference of the future solution. Because these data are very key, very important. Now, how do you keep the data? Because it's very important. Thank you so much for the time. So happy. I hope this kind of approach will be applied in our coming project that we are having. We have a project that is still in the assessment stage here in Rwanda. I really expect that I will use this approach this time around to ensure we'll get the best results, making sure that at least we also have the real impact. And I mean data for issue of sustainability. Data is very important to ensure that the impact has sustainability for the future. Thank you so much.
Thanks, Fred. Walter.
Wow. Thank you so much, my dear brother Fred. You really understand the context of Africa, especially East Africa. Leadership always has been our power. Men want to lead, men want to ensure that everything is under their control. And that is why we consider whatever we are doing this assessment and design, we realize that if we are to ask them, which one do you think it is the leading problem? Men will raise up their hand and then they'll speak and then they shut down everyone. That's why we came out with that secret, like, no, people need to vote. We have actually, we came across that, Fred, whereby actually there is most of the project people talked about women empowerment. In northern Uganda, actually people are saying women are being over-empowered. Will they not one day shut them down? Because every project that come women, That is why, Fred, that's why we involve the cultural leaders to understand the direction where we're moving. Because the cultural leaders, they always have the power. When they speak in public or in that kind of clan, they are always hard. Their voices are always hard. But now, if the cultural leaders had known the reason as to why they want to fight alcoholism, if the cultural leaders, which are also men, there are also cultural leaders which are women in one way or the other. And if the political and the religious leaders, they are aware, therefore that clashing between women and the leadership would no longer be there. They will realize that this is all about equal participation and equal ideas, and knowing that much as we are doing our cultural practices, we were sitting on someone silently. Right? They were bleeding, but we were not understanding them. Therefore, if that one is unlocked in a discussion, in a forum of discussion, they know that even if this woman is speaking in public, she's speaking because indeed gender-based violence has eaten us all. Indeed, alcoholism had made all our children not to go to school. They will know she's speaking at the angle of development. Therefore, that is how we are trying to combat, or that is how we are trying to erase the ideas like women are coming to take over power. No, the roles will still remain. Women will remain with their role, most of their, because each and every areas, they have the kind of roles that have divided, that men does this, women does this, but also through CoMEL intervention, we realize that, Walter, yes, I am a man, but I can cook. But for us culturally, only women are supposed to cook, but I can also cook. I can carry a baby. I can bathe a baby. So they are trying to understand that there are a number of things that constructurally all of us can do, except giving birth, Walter cannot, except maybe like those are some few things. Therefore, in terms of power struggle in CoMEL intervention, no men are complaining of power struggle between men and women. Data management, you're very right, Fred. This is still where, when it comes to that M&E part, the male part of it, it is a challenge on our side. Still, it is a challenge. As ADRA Uganda, we have made a metallic box, which is lockable. We gave them metallic box so that they can keep these records of the tools, the products, but also we have given them counter books that each and every product, the one you have seen, I've shown here, for them to have drawn in a book, such that they keep those books in their metallic box. And if that books maybe with time is becoming old, they can still continue saying, let us rewrite in another book, so that we are able to keep the story. So that is how we are trying to track the records or the data for each and every CoMEL groups. However, the data management is still low, and even data collection is still low. But that is how we are managing it, Fred. Thank you so much for that concern.
Thank you, Fred and Walter. Clara, you've raised a few different questions. I just want to give you a chance if you'd like to share some of them out loud.
Thanks, Nellie, and thanks, Walter. It was a great presentation, and I really appreciate your work and limited just to my top 3 questions because I could just go on to learn more about your work. Thank you for sharing today. The first was just what you determined to be the right size of a community. I imagine that if you were to approach, I'll exaggerate, a city, you'd have to find smaller neighborhoods or smaller groups within that so that this process would really be cohesive. So I wondered if you had insights on kind of the right size or the right kind of looking maybe for a common experience or a common factor to make sure that there's enough cohesion and sense of community among the group to make this work. And then another question was just a little bit about kind of what is your role during ongoing implementation to support data use? Do you and your team, your colleagues go every 6 months, every year, and kind of what that support process looks like? I'll just limit to those 2. Thanks so much, Walter.
Thank you so much, Clara. The first question, if I've understood you, are talking about the size or maybe the structures or the committee, in case maybe the community, the size of the community is smaller. I hope I picked you right there. If that is it, then we are looking at the number. Maybe what I can say is like we had never experienced such scenario because in our setup, you find that a village will always have a population of like around 300 to 400 people. and looking at the LC1, the local council one structures being 9, and they will be able to afford and have it. And then looking at the monitoring team that will put them aside, we always consider them around 11 of them. Therefore, at any one time in all these villages, we were able to realize this number of the CoMEL committees. We've never come across maybe a community that the number would be too small to the point that coming up with the structures would be a very big challenge. That one, we have never come across it. The second question was like, is it my roles and the frequency? Absolutely. One very important thing that look like a lesson learned is knowing the language or the dialects of that very community you're going to implement CoMEL. It is very, very important. Like for me, I am from this side. I speak the Acholi language very well. That made me actually, my facilitation was a little bit super, and maybe made it people to understand it much, much better because I understand the dialect. I can use their proverbs. All the corners, I can translate all these CoMEL tools to them. I can break it to the lowest level. For example, like theory of change, it was a little bit challenging for them to develop the theory of change. But how did I overcome that one? I had to bring it in form of garden because all these are farmers. I will tell them like, how much money do you expect at the end of the year if all goes well? They would say, I would like to have like 500,000 or 1 million. That would become the goal of the passion. There's okay, you are looking at 500. That become the community goal. I put it up there. Then how are you going to arrive at that 500,000? They will tell me, I'm going to plant sunflowers. I'm going to plant cassava. I'm going to plant ginats. So those become my outcomes. I put them, the 500 will come from sunflowers, would come from cassava, would come from ginat, and that is really my theory of change. It is done. Now, the outputs there will say, when you're planting cassava, there you must get the garden, you must look for the cassava cutting, you must ensure that there is a weeding, there's planting, there's weeding. Those form for me what we call the outputs, and that is where the activities come from. Now, when we bring it to the design, definitely they would pick it up very fast and develop that one. And for the frequency, yes, you're right. I am actually the only one person who is directly honoring the 21 CoMEL groups. And in terms of capacity building, I was the only one who was actually directly with Alec from Salanga, who actually kept following me every month, support me on monthly meeting. And in terms of frequency, there is a lot because I will be engaged with different activities. I may take like 2-3 months before visiting, and maybe like before visiting a particular group. That creates a very big gap. And with CoMEL groups, the moment they have just started, they need a kind of frequency, like lovers. When you're in love with someone, you call like 10 times in a day. You call like, you are the one, and so what, and what, how are you, good night. So with these CoMEL teams also, when you have just started with them, you need to be constantly with them such that they are able to adapt. Then you begin distancing yourself. Thank you so much, Clara. That's what you can give as my feedback in relation to your question.
Thank you, Walter. I am amazed at your ability to respond to all these questions as they're coming. There's so many. Wanjiro, you have your hand raised?
My address?
No,
Oh,
she's
okay.
hi everyone.
Let me
It's
hear
Wanjiru
then.
from Kenya. Hi Walter. Thank you for a good presentation. I'm glad that we thought Kenyans are the only ones who have those problems. I'm glad that we have similar problems. So it's good to know that we are all in this fight together. So I have a question. So my question is, how can organization ensure that communities genuinely lead decision-making process rather than simply being consulted? Because I remember one of the photos we were seeing you with the community, and so are we just consulting them to get information out of them, or are we genuinely leading or getting?
Oh, you cut out.
Are you able to hear me?
Now we can hear you. And
Okay, let me just start all over again. So my question is, how can organization ensure that communities genuinely lead decision-making process rather than simply being consulted? Because I feel like we are just consulting them, but we are not making them uh, we're not genuinely leading their decision making. I feel like we just want to get information out of them and that's it, and then we leave. What next after that? It's not just them giving us information. They can feed us information, but it won't help us in the long run, it won't help us. And I feel like this information is not just us for us to use it, also it impacts the community. So how can we as organization ensure that genuinely whatever information we get is not for us to make decision, it's the community through that information or whatever we have collected, it's what is making us make decisions.
thank you, Anjir. And I'll pass it over to you, Walter, but I just wanted to quickly say that I think that is like the question. It's kind of, it encapsulates the question on, I mean, on across community-led development, across all of the phases of CoMEL. And in particular, I think we'll also come to it. I don't know, Elaine, if you don't mind sharing the phases slide just one more time. I think it will particularly come up in sort of questions around the last phase, which is around dissemination, and also Fred's question about like where does the data go and who owns it in the end, of making sure that these processes, even after you've done them, even after you've involved the community at every stage, that it's still, you know, what happens to that information and where does it go and who uses it? That, how to make sure communities are still the owners of that part of the process also. So there in the number 5, share and inform, I think it will also, we'll have, dedicated conversations on that topic also. But Walter, I don't know if you have sort of a brief response to that very big, very important question.
Well, before Walter, because the chief gets the last say, right? But I think this is why we developed the principles as well, because it's about thinking through these principles, and then often in trainings that I do, we look at that continuum, something like that continuum that we did earlier in this session, and then we agree on what are the principles that we want to move towards, and using the principles as a compass, right? There's no like map. Like Walter has given us a really good roadmap, together with Salenga. Yeah, and I love it. But then, at each turn, how are you shifting power? How are you putting relationships first, right? And it may not be something that you do overnight. Change sometimes is incremental. Sometimes change needs to happen in small steps, because if it happens in big steps, it can be very disruptive, right? And this is when you have revolutions. And so how can you at each step just think about, okay, this is where I'm at. How can I take the next best step toward these types of principles? Over to Walter.
Thank you so much. I really appreciate this question so much, that how can we ensure that it's a community leading? An example in Uganda, there is a village called Labongoro. When they did their first data collection in their calculation, for them, they were fighting ignorance, and it is all about the low-level educations in their community. So the first data assessment, they realized that the number of children who always go to school, the percentage was only 41.5%. Now that one gave them a very big blow. Like, what are we doing really? It is only 41.5. Where is the 58.5? As a result of that one, they made a decision. They started highlighting what are the factors making their children not to go to school. One of them, like maybe paying the school fees. Another one, the access to the school. When you looked at the PowerPoint, there was a kind of a temporary bridge that children are passing through. That was the very bridge that very community, after realizing that the percentage of children are very low, they called the neighboring villages. They sat down. They say, guys, look, that was on their own. Walter did not participate in that meeting. It was them who mobilized the neighboring villages. Look, this is the same swamp or river or seasonal stream that all our children passes from, but we realize that it is stopping our children from going to school. So they call all those, they sat down, they raised money, they hired the power saw, they cut the timber, then they constructed a temporary bridge by themselves. And then, if we want not to lead the community, that is why we started bringing in the ideas of secret voting, such that men and women, they vote. And we realize that when they're voting, there is a way the women always go somewhere. Men always go somewhere. But because of the voting, we'll now bring all of them together. And you should not be biased when you're facilitating. Walter, I may know the very community that they are very good at drinking alcohol, OGBV is the leading things. I shouldn't be biased. I need to go by their decisions. Whatever they're saying, it is the common things disturbing them. They have to agree on that, even if I'm seeing this. And that is how we are actually trying to ensure that community are the one leading and they are at the center of the change. That's they derived. Sometimes, for me, with my knowledge of education, I may think, this might not be the root causes. But if that is what they're saying, it is a root cause from them. Work with them. In 1 year, they may realize that it is done. Therefore, they can review their theory of change and then do another assessment. And they realize that what they have done, it is different. An example, yesterday, I was in the field. There is this community that their major problem was GBV. But they did their first data cycle and the second data cycle. They realized that GBV had already gone down. Even alcohol has gone down. The alcohol is no longer even being sold in the village. Then they said, Walter, we need to sit down again and develop another theory of change because we are done with GBV, we are done with alcoholism. Maybe we want to move now into education. So that is how we realize that community are the one leading. Thank you so much. I love this question.
Thanks so much, Walter, and Wanjiru and everyone so far. There's so much good conversation happening in the chat, including I was just noticing, Clara, your question on baselines, which I don't think we have time to get to today, but maybe in the next call, we can make some space for. I wanted to, I don't even know if it's worth it to check whether anybody wants to touch base on any of the definitions that we had shown at the beginning. There's not really time to dig into that too much. Elaine, I see you're off mute. Maybe you have a...
Well, I think we did at least want to walk people through the charter for those that may be interested.
Okay, so we're gonna just transition the conversation. Again, Walter, thank you so much for this incredible and really thorough example, case study, and for all of your wisdom in practice. Elaine put it in the chat that we will figure out how to continue this in our next call, whether that's integrated into indicators also, or we'll figure that out. But we will keep talking about all of this. We will also send the questions that didn't get answered in this discussion to Walter and partners and try to get responses and share those out also in the meantime. But we had said we wanted to just give some time for folks who wanted to look at the charter. So we're going to use our last 5 minutes to review that in case anyone is sticking around for that part of the conversation. Elaine, over to you.
Right. So just quickly, as we said, these are living documents in the sense that we've gathered the ideas from the first 2 sessions where we heard from people what are we heading in the right direction in terms of the purpose and objectives of what we want to be doing as a community of practice. We want it really to be driven by those who want to be engaging and learning together. We identified this as a space that doesn't quite exist yet. There are a lot of people putting out webinars. There is the community owns Merle group that is mostly just emails. And so we want this to be a place where people like Walter, others in the group, and we have a few other people lined up, share about their experiences, and we can have this dynamic question and answer, and that as peers, you are learning from one another and answering each other's questions. And so just a bit on the background, you'll see that this is definitely about focus on that community-led monitoring evaluation. Sometimes we put accountability and sometimes we don't on learning. and that this is hosted by the Movement for Community-Led Development. And the purpose really is to advance that practice of, learning together. We will have some sessions in the future where we can focus on some of these questions where it's like, let's just brainstorm and through our collective ideas, what do we think at this point in time? And so it's really to build this network where we can learn from one another, and not just in this meeting, but people have put your names, your contacts. Feel free to connect with one another. It doesn't have to be led or managed by us. We want to synergize and share the learning. So this is why we record all the meetings so that people can watch it if they can't connect, and we'll find ways where we can continue the dialogue. And we want to start documenting existing guidance and tools so that people know where to go to. So some of these tools that Walter has been showing, I believe Molly, who is part of Selenga, who has been supporting this process, has put the link to Selenga's CoMEL on in the chat. But those are the sorts of resources that we will have there, and a number of guidance. And then there is a desire too to have some advocacy to influence donors and organizations to understand what does CoMEL bring, right? And so we've had this discussion. Walter's example is an excellent one to show that when the community is leading, when they are owning what they want to achieve, then it's exactly what we want to see in development and humanitarian aid. And I think in this time, especially, it's so important that we continue to build these civil society structures and voices and movements, as the governments are kind of doing their own thing, for lack of a better term. Who it's for, just to highlight again, it's not just for monitoring and evaluation folk. And so we're trying to find that common language, make sure that we have a common terms. We have people from grassroots organizations, people like Walter who are connected to communities. We have people who are part of headquarter organizations, people who are from the UN, consultants like myself, and Molly, and people who are just interested in furthering the learning and discussion on this. So we have the community of practice. That's anyone who's interested. Mostly you join by joining the Google group. And then we also plan to start up over time working in action groups. And so we have a few that we have positioned, and you'll find that at the top of the Google group. We have one around the sharing and learning under Movement of Community-Led Development. They have started an unlearning lab a couple years back. We have one on documentation, one on advocacy. And then there's the anchor group, of which myself, Nellie, Molly, Matt, who was joining previously, Mogapana, I'm not sure if he's still on the call, and a couple others who aren't on the call today are joining. So yeah, the where and when, you'll find out about it on the Google group. And then we have some principles you can review and see whether you agree with or want to add. And we hope to review this after a year. So I think that's time.
Thanks. Yeah, if you have feedback in that, just put it in the document. It's open for comments from everyone. I think with that, we will close the call. Thank you so much to the many people who stayed on for the rest of this call. In MCLD tradition, and now the tradition of this community of practice, if you want to, if you're able, go on video, come off mute, and say goodbye in whatever is your preferred language. We'd love to all say goodbye together.
So amazing. Murakoze cyane. Thank you. Greetings from
Murakoze.
Kigali.
Thank you. Bye.
Bye-bye.
Bye-bye.
Bye. Thank you.
Hi, everyone.
Thank you so much for everyone.
Thank you, Walter.
That's been a great opportunity for me. And I'm really very, very happy for all the positive feedback and all the questions that actually kept me more stable. And I will wish for this kind of opportunity again and continue sharing more.
Well,
I'll also be participating, hearing from others as we move to the fourth step. I have to participate and compare with the one of Uganda so that I can also give my input. Very interesting team. I'll join the team It is a very good.
Wonderful. We'll make sure you're added to the Google group. And now you have
Thank
this
you so much.
presentation that hopefully you can share in many different places because it's a great presentation.
Will
All
be my
right.
pleasure. Thank you.
Thank you
Thanks,
all.
Walter. Bye, everyone.
Bye. We're
Thank
going to close
you.
the call now, but